Chapter 3: Disinfection, Decontamination and Sterilization. Outlines: Objective, Introduction, Types of Sterilization and Disinfection, Chemical means of sterilization and disinfection, Physical means of sterilization and disinfection, Method of controlling sterilization. Objectives: Define disinfection, antiseptic and sterilization. Describe chemical means of sterilization and disinfection. Classify chemical means of sterilization and disinfection. List the physical means of sterilization. Describe the method of controlling sterilization. Introduction. Disinfection is destruction of microbes that cause disease, may not be effective in killing spores. Antisepsis, destruction or inhibition of microorganisms in living tissue, thereby limiting or preventing harmful effect of infection. Sterilization is the destruction or complete removal of all forms of microorganisms, including their spores. Decontamination is the treatment of an object or inanimate surface to make it safe to handle. Disinfectant are chemical solutions used to disinfect inanimate objects. Sanitization, any cleansing technique that mechanically remove microbes using soaps or detergents. Purpose: to prepare equipment for operation, delivery, tools, extraction, etc., sample collection, needles, syringes, etc., bacteriological cultures, petri dishes, tubes, etc., to disinfect contaminated materials. Means of sterilization and disinfection. The agents which are used for sterilization and disinfection can be divided into two broad groups. 1. Chemical. 2. Physical. 1. Chemical means of sterilization and disinfection. These chemical agents destroy any type of microbes without showing any form of selectivity, unlike antibiotics. The efficacy of these agents depends on the following factors: concentration of agent, time of exposure, pH of the medium, temperature, nature of the organism, presence of extraneous materials. 1. Concentration of agent. There is a relationship between the concentration of the agent and the time required to kill a given fraction of the microbial population. 2. Time of exposure. Microbes are killed with a reasonable length of time with chemical agent. 3. pH of the medium. The hydrogen ion concentration determines the degree of ionization of the chemical and bacterial surface charge. The non-ionized form passes through the bacterial cell membrane more rapidly than the ionized form. 4. Temperature. Bactericidal potency of the chemical agent increases with an increase in temperature. An increase in 10 degrees centigrade doubles the bacterial death rate. 4. Nature of the organism. Species of the bacteria, growth phase of bacteria in culture, presence of capsule, spore, and other special structures, number of bacteria in test system. 6. Presence of extraneous materials, organic materials like serum, blood, or pus makes chemical inserts that are highly active in their absence. Classification of chemical means of sterilization and disinfection. 1. Chemical agents that damage the cell membrane, surface active agent, phenols, organic solvents. 2. Chemical agents that denature proteins, acids, and alkalis. 3. Chemical agents that modify functional group of proteins and nucleic acids, heavy metals, oxidizing agents, dyes, alkylating agents. Classification: chemical agents that damage the cell membrane, surface active agents, cationic agents, quaternary ammonium compounds or quats, It causes loss of cell membrane semi-permeability, leading to loss of nutrients and essential metabolites. It can also denature protein, more active by inorganic material, inactivated by organic materials. Organic solvents, alcohol, example ethyl alcohol, isopropyl alcohol. Disorganized cell membrane lipid structure. Denatures protein, active against gram-positive bacteria, gram-negative bacteria, and acid-fast bacilli. Uses potent skin disinfectants. Disinfectants chemical, clinical thermometer. Note B. Ethanol is potent at concentration of 70%. Chemical agents that denature proteins. Example, acid and alkalis. Quatis, alcohol, causes conformational alteration of proteins. Acid like benzoic acid, citric acid, and acetic acid are helpful as food preservatives, extending storage life of food products. Chemical agents that modify functional group of both proteins and nucleic acids. Heavy metals, various metals, and metal salts are commonly employed to prevent microbial growth or kill microbes. Mercury compounds, example, mercuric chloride, limited use because of its toxicity. It can be used as antiseptics. Example, merthiolate. Silver compounds, example, silver nitrate, used as ophthalmic and wound, example, in burn patients. Antiseptic. Oxidizing agents converts functional SH group into non-functional SS group. Example, halogens like chlorine, and iodine. Hydrogen peroxide uses hypochlorite. Sanitizing dairy and food processing industries, households and hospitals. Organic or inorganic chloramines is effective water disinfectant acting by liberating chlorine. Iodine, effective skin disinfectant. Hydrogen peroxide 3% used for cleansing of wound, disinfecting medical, surgical device, and plastic contact lenses. Dyes, malachite green, brilliant green, crystal violet, gentian violet. Uses highly selective for gram-positive bacteria for treatment of dermatological lesions, for formulation of selective culture media. Second, physical means of sterilization and disinfection. Physical means of sterilization and disinfection include heat, filtration, and radiation. Heat is the most reliable and universally applicable method of sterilization. Mechanism of action. Dry heat denatures protein. Moist heat denatures and coagulates protein. 1.12. Dry heat. It is less efficient and requires high temperature and a long period of heating than moist heat. Incineration is an efficient method of sterilization and disposal of contaminated needles, syringes, and cover clips at high temperature. Flaming. Scalpels, neck of flasks, bottles, and the tubes are exposed for a few seconds, but it is of uncertain efficacy. C. Red heat. Inoculating wire, lobes, and points of forceps are sterilized by holding them in the flame of a Bunsen burner until they are red hot. D. Hot air sterilizer. Hot air oven or dry oven. It is essential that hot air should circulate between the objects being sterilized. This must be loosely packed and adequate air space to ensure optimum heat transfer. It is done by applying 160 degrees centigrade for 1 hour or 180 degrees centigrade for 30 minutes. Usually used to sterilize glasswares. 1.2. Moist heat is preferred to dry heat due to more rapid killing action. Moist heat can be used by the following methods. A. Boiling. Hot water boilers are still a common method in many hospitals. Maximum temperature is 100 degrees centigrade and will therefore not kill all the spores. However, when exposed for 20 minutes, All vegetative form of bacteria and virus can be destroyed provided that instruments are cleaned before putting them in boilers. B. Disinfection or intermittent steaming. Steaming of the material is done at 100 degrees centigrade for 30 minutes on 3 consecutive days. The principle is that spores which survived the heating process would germinate before the next thermal exposure and then would be killed. It is used for sterilizing heat-sensitive culture media containing materials such as carbohydrates, egg, or serum. C. Pasteurization. Pasteurization is the process of application of heat at temperature of 62 degrees centigrade for 30 minutes or 72 degrees centigrade for 15 seconds, followed by rapid cooling to discourage bacterial growth. Uses: pasteurization of milk, preparation of bacterial vaccines. D. Autoclave. Steam under pressure is based on the principle that when microorganism is boiled at increased pressure in closed container, hot saturated steam will be formed which penetrates and gives up its latent heat when it condenses on objects. Hot saturated steam in autoclaving acts as an excellent agent for sterilization because of high temperature. Other methods using low temperatures. Freezing at 0 degrees centigrade less temperature is inactivation of living bacteria by cold. It prevents active multiplication of bacteria by decreasing the metabolic activity of bacteria. It is more of preservative than disinfectant. B. Lyophenilization, freeze drying, is a process which involves rapid freezing with subsequent drying. Uses: preservation of microbial cultures, preservation of vaccines.